So they got normal afferentation coming from the elbow joints. And then what happens is you start to eat chocolate cake. And you eat chocolate cake over and over again. And your pancreas makes insulin. And each time you eat the chocolate cake, your pancreas got to make insulin. And you're eating so much chocolate cake, you're putting so much carbohydrate into the body, it's got to make a whole bunch of insulin. So it's making all this insulin, and it's working harder. Now that doesn't happen without a somatic manifestation. And the somatic manifestation of the pancreas working harder, going into a hyperinsulinism pattern, is such it's going to fire the pancreas-related muscles to a hyper state to increase their function. It's going to fire the triceps, more than the latissimus in this case, and it's going to fire the triceps so you're getting flexion, extension, but it's going to be firing the triceps so you're going to be getting more extension than flexion. Because the triceps are going to be firing over and over from that hyperinsulinism pattern. And you're going to have this happen over and over again to the point of you start to get elbow pain. Or you start to jog and your fingers start to swell and go numb. Or you take walks and your hands start to go numb and sometimes even swell, which is a symptom of hyperinsulinism, by the way. And it's because you're not getting full range of motion in your elbow joints. You're getting too much triceps, not enough biceps. You're getting a deafferentation of the elbow joint, probably the shoulder joint as well, probably the wrist joint as well, not getting full range of motion. And so somebody comes along and adjusts your cervical spine, and all of a sudden you increase your afferentation a little bit, and your elbows feel better, and your shoulders or wrists feel better, whatever it is. But the hyperinsulinism pattern keeps driving those triceps to greater and greater activity, and pretty soon you don't have full range of motion. You got imbalance in the elbow, and you got your elbow pain back. So somebody else comes along and says, okay, let's treat this chemically. And they said, get off the chocolate cake. Take this chromium. Take this vanadium. Take this pancreas tissue. Take some sesame seed oil, whatever it is. And all of a sudden, the pancreas, the hyperinsulinism pattern, starts to lit up. The triceps don't have to fire so much. And all of a sudden now the triceps lit up, and you set biceps working more in balance with the triceps with reciprocal innervation, and now you get better full range of motion. And now you don't have pain in your elbows. And now your hands don't go to sleep when you're walking or jogging. And now you don't have any bilateral upper limb symptoms because you got full afferentation coming from the elbow joints, coming from changing the chemistry. So we see these patterns, and this is the kind of symptoms that we see. Even though the patients don't complain of lack of range of motion in their elbow, there's a tendency for it to sometimes go in greater extension when the triceps are overfiring from the hyperinsulinism, because that's a pattern that you see muscularly with the hyperinsulinism pattern. So restore normal afferentation. Sometimes we can do it rapidly by making a correction of a reflex or adjustment, but sometimes we have to restore it permanently by making a chemical change to restore the normal afferentation pattern to give normal joint range of motion.